Meanwhile, Quebec is also imploring residents to reduce their contacts by another 25%. That's after new modeling revealed cases will keep rising there even into the new year, even under current red zone restrictions. The number of cases in Quebec over the last 24 hours has once again topped 1,000. There are 507 people in hospital, up 14 from yesterday, and 87 in intensive care, an increase of 4. The highest increase in cases are in Montreal, Montérégie, and Quebec City, the first regions of the province to be put in the red zone. So will the province crack down further? Christopher Skeet is Parliamentary Assistant to Premier Legault for Relations with English-speaking Quebecers. He joins me from Laval. Welcome back to the program, Mr. Skeet.
Thank you again for having me, guys.
Happy to have you. Now, Quebec is once again leading the country in COVID cases. And I just want to ask you, on the big picture level, why do you believe that is the case, that Quebec in particular is struggling more?
Well, we're still carrying over the previous high incidence that we had at the beginning of the pandemic in the spring. So, of course, it was a latent amount of cases that were just harboring and lingering underneath the surface. And I think that's one of the reasons why we have a higher incidence, and also, just the general dynamics of our population. I think, in the summertime, there was a little bit of a relaxation, and I think people, while they got back to the beat in the autumn season, I think people carried over some of their habits from the summertime, and now we had to tighten things up a little bit.
Okay, and as you look to tighten things up, our audience well knows about the various red zones in the province, but I'm interested in this report today that came out from the National Institute for Public Health in Quebec that recommends people reducing their contacts by 25%. And I'm curious, we heard the Health Minister, Minister Dubé, talking about this. Is that just a suggestion, or is there a world where you would try to institute some kind of measure in order to get people to interact less above and beyond what you're already doing in the red zones?
Well, in early October, we asked Quebecers to just be careful about the number of contacts that they're going to have, right? And it's an exponential thing. When we look at the R0 number, it tells us that the more people we come in contact with, the higher the rate of transmission will be. So if we reduce the amount of people that we see, we reduce exponentially the number of cases that we're going to have. So we're asking Quebecers to be mindful of that data and to ask themselves, whenever they're contemplating meeting somebody, if whether or not it's a good time and if it's absolutely necessary to have those meetings. And I think by putting the trusting in our population's good judgment, we're hoping to reduce those, and we're asking them, by giving them a firm number of 25%, what to reduce.
Now, you say trusting in your population's good judgment. I want to ask you about one particular instance that stood out to me in Saint-Jean-sur-Richelieu. It's a bingo hall. Got a warning on Friday for having an event with 250 people. I think that's about 5 times, 10 times the maximum that we're allowed. It got a warning, and then on Wednesday it was busted for another event with 170 people. And I wonder, when you hear that, does that suggest to you that there's some sort of enforcement problem, that you need to crack down even more?
Well, no, the truth is, those people are getting fined, and we are acting to limit those types of things. But of course, it's unbelievably irresponsible behavior, and it's not something that we would encourage, obviously. We're going to act when we have to and intervene when we have to in those types of cases. But of course, exceptions don't make the rule. But yeah, there are those people who just haven't gotten it yet, which is why we try to communicate with the population as often as we can. We try to educate them with the data and with the facts that are on the ground.
Yeah, I mean, I did hear Minister Dubé today talking about perhaps trying to reach the people who aren't getting the facts. I do want to ask, though, when it comes to measures, different parts of the province have been made red zones at different points, but some of the first ones that were sort of brought back into the red, if I can put it that way, they're about halfway through this 28-day period. And my understanding is the government has indicated that some of these measures are going to have to continue if you hope to see the numbers continue to flatten. So do you have a sense of how long people might be asked to continue particular measures?
If I had a crystal ball, I would have taken it out already. I think we're going to be in this for the long run. But the idea between the 28 days, lest we recall, was that we were going on an upward trend, and we had to stop that trend. And I think, we're cautiously optimistic that we've hit a kind of a plateau at around 1,000 cases per day now. And we're hopeful that if we can stay at this level, it's something that our healthcare system could tolerate going into the fall. But of course, this is a whole bunch of unknowns compounded with a whole bunch of unknowns and unprecedented events. So we're doing the best we can with the information that we have. And of course, until there's a vaccine, until there's something more permanent in place, we're going to have to get used to some kind of alteration to our day-to-day life.
You raised the issue of healthcare, and I want to expand this discussion to what has been going on in terms of the federal-provincial discussion about long-term care, setting national standards for long-term care. Of course, the state of long-term care on the minds of so many Canadians, given the horror stories that we saw in the midst of the first wave and the problems that are starting to re-emerge. Federally, Minister Dominic LeBlanc said today that the premiers are excited to be working with the federal government on this issue. Is Quebec excited about national standards for long-term care?
Quebec is excited about the prospect of having adequate funding transferred from Ottawa.
I don't think that's a yes.
We'd be terribly excited about that kind of a discussion. You know, when we forget that when healthcare was first instituted across the board, the commitment from the federal government for instituting that type of national program was compensation. And at the time, it used to be 50%. Now we're down to 22%. So it's a wonder why provinces are now bearing the brunt of the healthcare costs without the adequate transfers. I think that's a discussion that we need to be having. And under the leadership of my premier, who's now president of the Council of the Federation, maybe we can make some steps there. I think that would be the best way for Ottawa to help, is to increase those transfers.
I think it is important to say that there is, I'll say, a debate over those numbers. Different folks come forward with different levels of figures. You said 22. Some people would say it is higher than that. But that is not where I want to take the discussion to right now. I just want to be crystal clear. This is a commitment that the federal government has made. Our national standards for long-term care just a non-starter for Quebec? Is there any world, if it is, for instance, tied to funding or something, where this discussion is a possibility?
Well, at the beginning of the pandemic, I remember we were begging and pleading with the federal government to close the borders. Of course, it wasn't our responsibility to close the borders. It's a federal jurisdiction. I wonder if the federal government would have been open to us unilaterally deciding to close the borders, right? So I think it's important in a federation to respect our jurisdictions. Quebec is going to respect its own.
The fact that the federal government had to send in the Canadian forces, do you think that the Prime Minister has returned to that time and time again, saying, obviously that did not just happen in Quebec. We know very well that it happened in Ontario, and that some of the most alarming stories, we should say, actually emerged from the long-term care homes in Ontario. But nonetheless, does that, I guess, reduce your ammunition? That there's obviously a role for the federal government if things got that bad?
Actually, I think it increases our ammunition to say that if funding was adequate, none of the provinces would have been there. I think if we limit the power of spending of Ottawa and put in the adequate transfer that should exist, regardless if it's 22, we can dispute the numbers. I'm pretty sure it's 22, but it's not 50. And if it was at that level, then of course we wouldn't have been in those types of situations. And healthcare is one of the points in our budget that have gone up above inflation for years and years and years, and now represents 55% of our budget. Now, of course, if the federal government was transferring at the same levels that it was historically, would we have needed the army? I think that's the question that we need to have. But of course, now's not the time to play, blame games.
Listen, that's something very significant that you said, Mr. Skeet. And so you're saying that the responsibility lies at the feet of the federal government for what happened in Quebec's long-term care homes? Those horror stories.
What I'm saying is, and just to be clear, I'm not placing blame. I don't think it's an issue of blame. What I'm saying is Quebec and other provinces have issues with funding healthcare, which now represents the majority of our expenses in the province. 55% of our budget goes towards healthcare. Now, of course, when when healthcare was invented in Canada, it was funded at 50%. Now it's significantly less than that. We have to wonder if provinces are able to keep up with that funding when they don't have the adequate means.
Okay, well, I would say
to get the revenues that Ottawa does.
I would say this does not bode well for the federal government's objective on this issue. But before I let you go, there is one more issue that also relates to healthcare that I want to ask you about. It is the ongoing discussion. There's discussions happening in Ottawa today, as you may know, about anti-Indigenous racism in the healthcare sector. And this has been very much brought to light by the death of Joyce Echequan, which of course happened in a hospital in Joliette. She recorded her death. People, I think, know very well by this point some very disturbing things that were said to her in the moments before she died. Premier Legault has refused to accept identifying systemic racism, not racism, but systemic racism as a problem in Quebec. And I'd like you to hear what Indigenous Services Mark Miller had to say. He's also an MP for the Montreal area on this program yesterday about that issue.
We know that racism kills and systemic racism kills systematically. If you can't acknowledge the problem, you can address it from a public policy perspective in order to weed it out. Implicit bias can result in outcomes that can lead to people's death, and we need to recognize that.
If you can't acknowledge the problem, you can't address it. How do you respond to that?
Well, it's false. I sit on a committee with 6 other members, including the Minister for Indigenous Affairs and 2 other ministers of my cabinet, 3 of which are Black, are sitting on a committee right now to address concretely how we can address issues of racism in Quebec. So we can disagree about what the title of the book should be, but I think we all agree that within the book there is racism, and there are certain actions that we can take. I disagree with the assertion that you have to name it a certain thing before you can make progress. I've been a victim of racial profiling, and I'm more concerned with solving that issue than naming it.
A 2019 report commissioned by the City of Montreal concludes that Black and Indigenous people are 4 to 5 times more likely than white people to be stopped by Montreal police. That is not systemic racism?
I have been a victim of that racial profiling. I'm more concerned with the issues behind the profiling that occurs as opposed to the label. I think what we can do is look at how these issues happen and why they're doing it. We can focus on educating our police officers to making sure that they understand cultural diversity. We can implement training programs at the school, at the national level, to help them better understand cultural differences. I think that's where we should be putting our efforts, as opposed to just some random name that doesn't have a consensus in Quebec. I think what we want to do is unify all the forces, all the different points of view, and say, hey, there is racism, let's tackle it where it exists.
You have the head of the Quebec Human Rights Commission. I mean, you have the Vien report, which is over a year old now. You know, the Premier came out himself after that report looking at the treatment of Indigenous people in the province. He apologized for the state of things. He talked about the role of the state. I just wonder what would happen were you to say that this is a systemic issue? Like, what is the concern about that when there are so many sources within the province, people who are experiencing this racism firsthand, saying it is part of the system and that is how we need to go about addressing it?
Well, we're trying to unify Quebecers against racism. And since that particular term doesn't have any consensus in Quebec, what we're focusing on is action. Part of what my committee is looking at is exactly how to address those issues of the Vien Commission or the Infata report, or also racial profiling as it exists, or things like discrimination when people are being hired for jobs in the civil service, why the levels are so low. We're looking at all those concrete things to see how we can move the needle on racism as a whole. And I think everyone in Quebec agrees that we need to eradicate racism. Let's just focus on what's unifying us as opposed to a term which doesn't have a consensus here in Quebec.
Okay, we're going to leave the discussion there today. Thank you very much for your time, Christopher Skeet.
Thank you for having me, and be safe, everybody.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.